Frequently asked questions about naloxone. This is printed in the National Library of Medicine, National Institute of Health. Number 1. How effective is naloxone at preventing overdose deaths? One study showed that 96 of 100 people survive an overdose when they are given naloxone or Narcan. More overdoses are treated when more naloxone is handed out and more people are trained. 2. Can naloxone be administered to anyone? Yes. Naloxone can be administered to all ages, including those who are pregnant, who have heart or kidney disease, or have any other health condition. Naloxone is very safe. 3. What if my kit is expired or exposed to high or low temperatures? Store kits at room temperature and replace every 2 years. But you can use any kit you have. Recent research has found that naloxone can even be good for up to 30 years, even after exposure to extreme temperatures. They tested with boiling and freezing, and after the kit expires. Never throw Narcan away. If you do receive more recent, newer Narcan and you choose not to hold on to the expired Narcan, please give it to an organization that will use it. Naloxone won't increase opioid use. Studies have shown that there's no increase in drug misuse when naloxone kits are handed out. Naloxone is like epinephrine or an EpiPen for allergies. Both help in an emergency. How well does naloxone work for overdoses caused by fentanyl? Naloxone works well for overdoses caused by fentanyl. Overdoses involving fentanyl may or often need more than 2 doses of naloxone. If an overdose is suspected, administer a dose of a naloxone every 2 to 3 minutes until the person responds. Giving multiple doses is okay. There is no pharmacological evidence that fentanyl or its analogs are pseudo-irreversible or non-competitive agonist or opioid receptors. The apparent failure for naloxone to reverse an overdose is more likely to be caused by other factors, such as errors in administration, higher potency fentanyls, high opioid doses, or contamination of fentanyl with another central nervous system depressant, such as benzodiazepines. Always administer naloxone if you suspect an opioid overdose. Even if there is no apparent response, getting naloxone doses into a patient provides a head start to additional doses and interventions provided by emergency personnel. Can I experience a fentanyl overdose via accidental exposure? Individuals may be concerned about exposure to fentanyl when helping victims of overdose. However, experiencing opioid toxicity from accidental exposure to fentanyl is highly unlikely. A joint task force of the American College of Medical Toxicology and the American College of Clinical Toxicology concluded that fentanyl pills and powder do not pose any risk of causing overdose. Absorption of fentanyl through the skin is very slow and would require pharmaceutical grade patches or dissolved fentanyl to be absorbed over a large surface area. Absorption through mucous membranes such as the eyes and mouth may be greater. Pulmonary absorption of heated or aerosolized fentanyl is possible, but can be prevented through standard respiratory protection.